Hi counselors, welcome to another video from Counselor Tips. In this particular video, I am going to be talking about the blended models of supervision. The blended model is founded on, well, like it says, blending, the insight-oriented as well as the skill-oriented approaches in supervision. The blended model of supervision was really developed around working with a substance abuse counselor. But it doesn't mean that it is just restricted to supervising a substance abuse counselor. It can be used as a supervision model with all counselors. There are some philosophical underpinnings of this model that are important to know while deciding if this model is applicable for you or a supervisee. So the first philosophical belief is that people can bring about change in their life with assistance and guidance. The second philosophical underpinning is that people are not always aware or maybe blinded to knowing what is best for them. They may have problems like being resistant or being in denial, and as a result, they can't even identify, let alone address their issues. This model also believes that the key to growth is blending insight and behavioral change, and doing it at the right times with an appropriate amount. This model believes that change is inevitable and constant. An additional philosophical underpinning of this blended model of supervision is that the supervisor or guide concentrates on what is actually changeable. Another philosophical underpinning is that there is this belief that one doesn't need to know where problems have come from, the cause of the problem, or how the problem is manifested in order to develop some kind of solutions towards resolving the concern. And the last philosophical underpinning of this model is that it honors that there are many ways to view the world. This blended model of supervision is really a developmental model. There are several stages that are followed in this developmental model. This model challenges supervisors to look at some key things in themselves. So before one defines their approach to supervision, they're going to look at multiple different things. So the first thing the supervisor will look at is their personality style. Their leadership style is another. Their style of teaching, as well as becoming aware and understanding their own underlying concerns. In this first part, the supervisor is also aware of their own level of training, experience, and knowledge. In addition, the supervisor is aware of the supervisee's own level of training, knowledge, and skill development. The supervisor needs to be able to define their own philosophy around health, as well as their understanding of how change occurs. The supervisor is also aware of the contextual factors that shape the supervisor. Things like age, whether a supervisor's in recovery or not in recovery. There's ethnicity and gender, educational background, and so forth. This looks at the characteristics of not only the supervisee, supervisor, and client, but also that the setting affects the environment of supervision. The supervisor is the determinant on how they will address affective and behavioral concerns in supervision. This is mainly based on the stage of counselor development and the strength of the working alliance in supervision. There are multiple dimensions, and they also fall into different levels of supervision. In the blended model of supervision, there are 3 levels. So as I'm covering the different dimensions that could be affecting supervision or provide an area which the supervision is developing, I'm also going to be citing what levels you can see these dimensions appear. Influential and symbolic dimensions. This dimension has the premise that supervisees are influenced by both affective and behavioral, and it's really dependent on the individual's stage of development, needs, and cognitive abilities. Beginning clinicians will be looking for basic counseling skills. and advanced clinicians will be addressing more theoretical orientation as well as interpersonal concerns. In the symbolic dimension, we will see things that are like latent or unconscious symbolic material that may appear, but it's not significant in order to bring about change. In the structural dimension, there would be a very structured approach with novice or beginning clinicians. It would really emphasize mastery in core functioning areas. As the supervisee grows, the structural component really shifts from proactive on the supervisor's part to reactive on the supervisee's part. The supervisee begins to develop mastery as well as increase responsibility for the direction of supervision. It would be like when the supervisee has begun to master some of the counseling skills and theory use, that they would begin to address things like counselor burnout or future potential growth, areas where they want to specialize, and so on. The replicative dimension. So in this dimension, supervisors are well aware that supervisees actually progress in a parallel process as to clients in therapy. In the blended model, even though this is acknowledged, it's not often addressed. It would only be addressed if then this parallel process interferes with clinical functioning. In the blended model, clinical intervention, or the supervisor being more like the counselor to the supervisee, is not considered an essential ingredient in supervision. The blended model sees it inappropriate for the supervisor to provide any kind of clinical interventions to a supervisee. Information gathering dimension. This looks at levels 1 and 2 are crucial stages for the development of a supervisee. In this dimension, it also guides supervisors to gain as much information on their supervisee's clinical functioning. In this dimension, and as well as in these levels, direct observation of the supervisee's counseling experiences is imperative. As the clinician grows in 3 developmental structures, which are motivation, self and other awareness, and autonomy or independence, the supervisor can utilize more insight-oriented approaches and thus be more indirect in gathering information around techniques that the supervisee is using. The strategy dimension. Depending upon the supervisee's stage of development, the supervisor is providing a level of teaching related to technique and theory. Supervisees in levels 1 and 2 may need to focus on some of the core areas related to the counseling relationship. Supervisees in other areas may need to focus on different models of recovery and intervention specifically related to the clients that they serve or special populations they work with or certain diagnoses they work with. Jurisdiction dimension. Sounds like court. In this dimension, it guides the supervisor to take ultimate responsibility for the supervisor and supervisee relationship. It is posing that supervisors cannot escape the ethical and legal implication of every supervisee as well as every client the supervisee works with. Relationship dimension views the supervisory relationship as more directive for levels 1 and 2 and believes that the supervisor will be less directive as the supervisee gains more competence and skills and knowledge, such as in level 3. The journey dimension. Da-da-da! 1. You will pack your bag and get ready to go. If the supervisor is working with a level 1 supervisee throughout the journey dimension, the supervisor will be helping the supervisee do things like develop professional identity, see how they can integrate the ethics code into their own professional identity, begin to look at areas where they could focus and gain more mastery. In the journey dimension, if a supervisor is working with a level 3 supervisee, they're going to be assisting supervisees in gaining the ability for more introspection and professional reflection. The internalization dimension. An example for a level 1 In the internalization dimension would be a supervisor helping a supervisee isolate external philosophies from the supervisee and help them understand the compartmentalization of these external philosophies as they may be affecting their practice. On the other hand, if a supervisor is working with a level 3 supervisee, they may be aiding supervisees in developing wisdom and integrating therapeutic behaviors and attitudes. The listening dimension. When a supervisor is working with a level 1 supervisee in this dimension, they'll be listening with their head. When they're working with a supervisee who's a level 3, who's attained more mastery, more skill and knowledge application, the supervisor will be listening with their heart. Lastly, in the blended model supervision style is the questioning dimension. If the supervisor is working with a level 1 supervisee, they spend more time answering questions from that supervisee. If they're working with a level 3 supervisee, they spend more time posing questions to the supervisee in order for the supervisee to access their own knowledge and skills and information that they have gathered from practice to teach them to answer their own questions. Thank you for joining me for this video on blended models of supervision. Remember, the blended model of supervision can be used with any kind of counselor that you're supervising, if it best suits you and your supervisee. If you believe this video can help another supervisor or counselor, please consider passing it on. If you feel that you're learning from counselor tips and want to continue to learn in a multitude of different topics that I cover, then please consider subscribing to this channel. And hey, turn on the bell. That way you know when I have a new video. I'll see you soon.